ramus of the mandible, and this is the body of the mandible. The lower border for attachment of platysma. This is the upper border of the mandible having the sockets for lower teeth. The ramus of the mandible, its outer surface for attachment of masseter muscle and its angle. And this is the coronoid process for attachment of temporalis, and this is the condyloid process. It has head and the neck. The head and the neck. The head for temporomandibular joint in the fossa related to it in the skull, at the base of the skull. And inside the head, a fovea called the pterygoid fovea. Pterygoid fovea. Ma'am? This notch is called the mandibular notch. This foramen is called the mental foramen for mental nerve. And the foramen on the inner side is called the mandibular foramen. Mandibular foramen. Tamam? Covered by lingula. This small part is called lingula. And this is the mylohyoid line. This line is called mylohyoid line. And this tubercles is called genial tubercles for attachment of genioglossus and geniohyoid. Genial tubercles. And the two fossa below it are called digastric fossae. Digastric fossae. Digastric fossae for anterior belly of digastric. Tamam?
This testis, okay. We have to know it's right or left. How to know that it's right or left? By 3 points. The first point, by this structure. What is this structure?
Artery?
No. Spermatic cord. This is spermatic cord. Okay? Spermatic cord is directed upwards. Spermatic cord is directed upwards. Okay? The second point. What is this structure? It is epididymis. Epididymis in the posterior.
This group?
No, not the group. This structure.
Okay.
Yes, this structure is epididymis. Epididymis is posterior. Okay, and the last point it is
the right artery? Right one?
the last point. It is the sinus between the testis and the epididymis. Sinus on the lateral aspect. On the lateral. So we have 3 points. Sinus is lateral, epididymis posterior, and spermatic. Yes. So it is right testis.
Right.
Yes.
You don't have any other structures to mark?
No, it's spermatic cord, testis, epididymis, and the sinus.
Sinus.
Yes, and right or left.
Right.
Okay.
This is a spermatic cord. Right.
Right. Yes.
Spermatic cord?
It has no spine. It's no spine. The second one, C2, is axis. Axis has a deltoid process that fits in here. So atlas, axis. Okay? Axis is known by the deltoid process. Axis has no spine. Its shape is specific. Okay? This is the typical vertebra. It has a body, it has two foramina, it has a process that should be bifid. Has two processes, but it's broken. Okay? The last one is C7. It should have a very long spine. Okay?
Where it is?
I don't know. So this is atlas, the first one, C1 atlas, deltoid process, C2 axis. This is the typical from C3 to C6. C7 has a very long spine.